All medical treatments, of course, carry some risk, and every general anaesthetic carries some risk, but the risks are extremely small.
So we want to make sure that the person's as physically well as possible before they undertake the procedure. We do a series of blood tests, an ECG to make sure that the heart's okay, and any other physical investigations that are needed to make sure that they're really well before we proceed.
The main problem with the ECT are the side effects on memory. There are two kinds of memory effect that can occur with ECT. One is short-term memory and the other is long-term memory. With short-term memory, people tend to get a little bit forgetful from day to day about what's been happening in the previous day or so. The other main memory problem is called retrograde or long-term memory. And people can have the problem of losing some long-term memory, memories that have already been laid down over the previous year or maybe a bit longer. Things like forgetting a PIN number, a phone number, maybe a recipe or where you keep something at home. These are things that can be relearned, of course, but it's always wise for people to note those things down before they have treatment. But people can sometimes also notice that they've lost memory for certain personal events, such as a family gathering or a person they've met or a dinner out that they've had. And sometimes some of those things won't come back.
You know, it came at a cost.